Fluoride is very important for children's teeth, and we recommend that starting early. I mean, a lot of kids, when they're younger, obviously they can't spit out the toothpaste. So, as soon as the child is able to spit out the toothpaste with fluoride, we encourage parents to use very small amount of toothpaste that has fluoride in it, and which will really helps repair early tooth decay, and also it strengthens the enamel, which is the most outer part of the tooth, and it really helps the children from and preventing them from getting cavities in the future. Sealants are placed in the molars. We put them in the permanent molars mostly, and they block the deep grooves in the teeth from food getting trapped in them or bacteria getting trapped in them. And so toothbrushes bristles can't always reach those areas. So that's why sealants block those grooves, and it prevents food from getting trapped in there. So that's why it's important to use sealants on a permanent teeth as soon as they come out between the age of 6 to 7. And, um, and it really reduces the cavities in molars by 80%. And fluoride is completely different. Fluoride can also prevent cavities, but it doesn't block the grooves in the teeth. It can be in the water, it can be in the toothpaste, and it remineralizes the enamel of the tooth versus sealants. It blocks the groove so it doesn't let the food get into the roofs. And it's basically so sealants physically shields the teeth, and sealants strengthens the tooth enamel. They neither is better. They do actually different jobs. So sealants again, it just physically blocks the food and bacteria, and only it actually only protects the chewing surfaces versus fluoride. It strengthens the enamel, and it helps repair the early decay, and it's just best for overall cavity prevention. And sealants is also great for high risk teeth, especially in kids because they don't brush their back teeth, they don't brush their molars well. So they're different and they work well together. The best age to start sealants is around age of 6 or 7 when children get their first permanent molars. So parents actually ask this question a lot, that if sealants are safe for my child. Yes, sealants are non-toxic and widely they are used for decades, and there's no drilling, there's no needles, there's no paint, and the amount of material that we use on the teeth for sealants is very small. And major pediatric and dental offices, they use that and they recommend that. And the best age to start it, again, it's when they start having their first molars, which is normally between age of 6 to 7. I mean, some children, they get it earlier, which is age of 5, and that's when if they're cooperative and they're able to sit in the chair, keep their mouth open, then that's when we like to apply it, or if they don't have a high gag reflex. Typically, these sealants last 5 years. In some kids, we see them for 10 years even. It depends on what they eat. If they eat a lot of sticky food or sticky candy or their chew gum, they can come off faster, but we can check them at a regular dental visits and to make sure they're still there. If not, we reapply them. And again, they are safe, they are painless, and they're very effective. So, and they're not toxic. So, we do highly recommend them for children to use them, to apply them. We normally recommend students to kids who have high risk of getting cavities or kids who cannot brush their teeth well. We recommend an adult to brush and floss for them until age of 9 or 10 because their fine motor skills is not fully developed until then. So it's important for an adult to brush and floss for them. So sealants also helps those back molars not to get cavity by getting the grooves blocked. So it's very good. We highly recommend it for all children, but it's definitely recommended for children who have a high risk of getting cavity. The way we help the parents to decide which preventive option is better for their child is that we talk to them regarding, both of them. We always try to educate them and make sure they understand the difference. Is this child very prone to get cavity? Does this child have help at home and somebody helps her or him brushing his teeth? So children, fluoride really helps the children not to get cavity by straining the enamel. So if it is in their toothpaste and they're using it daily, it really helps them not to get cavity. If the parents are not around always brushing their teeth, that fluoride in the toothpaste really helps them not to get cavity. So, but if there's also a child that is very high risk in getting cavity, we recommend sealants. Sealants, prevent those grooves. So if this child is constantly getting cavity or those enamel are more prone to get cavity, then sealants can block those grooves and help them with decreasing the chances of cavity. So, and then we'll also see some kids with very deep grooves in their molars. So those sealants also help them. And then under age of 6, fluoride toothpaste and fluoride toothpaste really helps them. But you have to remember you need to use very small amount, like a pea size. We're not using too much over age of 6, which that's when they have their permanent molars. It's a good age to start applying the sealants. Again, the patient has to be cooperative and be able to sit in the chair and um we don't want to scare the children. We want to make sure they're ready for it. And again, it's painless and there's no shots and there's no risk for it.